speaker.
You are the first. Is
All right.
that exciting?
I just didn't know who's been here and what they've learned about already, that's all. So I'm Rebecca Deffner, I'm a family nurse practitioner. I currently work at the Aspirus Corona Water Clinic. I'm just gonna need you to do that eventually. So I'm going to actually whiz through some of the education stuff. I will have my contact information on the end if anyone has any questions, if I went through things too fast. Because the education piece is important and you guys might have some questions, but I want to make sure we have enough time at the end to go through questions. And I have some fun slides and things at the end, so I just want to make sure we have enough time. So just a couple definitions. A nurse practitioner is a healthcare professional who is educated and trained to provide health promotion and maintenance to the diagnosis and treatment of acute illness and chronic conditions. So by definition, we are a registered nurse. So we have a 4-year undergraduate degree as a bachelor's degree, and we go on for additional training. Most programs at this time do not require a certain length of time for you to be a registered nurse before you go on to schooling, but I think in time that may change a little bit. So, okay. Again, history I'm not going to go into too much, but it's been the nurse practitioner, the advanced nurse practitioner role has been around for a very long time. First roles were nurse anesthetists, so the people that help put people to sleep during surgery, nurse midwives who deliver babies, and then psychiatric nurses. So primary care provider, the role was really created long ago to provide additional healthcare support for just a shortage in physicians, to kind of bridge that gap, to help have people that can provide more advanced medical care beyond a nursing degree. Go ahead. That's Florence Nightingale. I don't know if anyone's into nursing. Is anyone in any medical, anything at this point? Any like EMTs, lifeguards, CNAs, anything? It's a good experience if anyone's looking at doing anything in the medical field. No matter what realm you go into, now is the time to kind of get your feet wet, start networking with people you might know, do some shadowing, get some experience. Volunteer places just to kind of get your feet wet, looks good on a resume, might help you actually figure out what you like or maybe what you don't like. So, go ahead. Education, again, 4-year degree, Bachelor of Science in Nursing, a lot of great programs throughout the state of Wisconsin, that's all I can speak to really. I went to Viterbo University in La Crosse for my undergraduate degree. And then you need to go to an accredited graduate Master's of Science in Nursing program or a DNP program. So if you ever hear anyone call them a nurse, that's actually pronounced, gives themselves the type of doctor. There is a doctorate of nursing practice degree as well. So that is the highest education you can get. And I don't have any intention of doing that. No more school for me. So the typical curriculum, all of the same in nursing. So epidemiology, so bugs, diseases, that sort of thing. Health promotion, how can we keep people healthy, pathophysiology, why the body works, how it works, anatomy, physical assessment and diagnostic reasoning. That's probably the step from a bachelor nurse to a master's prepared nurse, where you learn a lot more about the body and diagnosis and treatment of diseases. Pharmacology, very, very, very important to learn about medicines. Laboratory radiology, diagnostics, of course, very important. Statistics, not my favorite, but is important. Research, also not my favorite, but is very important. And some other things, including role development and leadership. Minor acute and chronic disease management. So the facility that I work in is a primary care clinic, meaning when you just kind of go to the doctor once a year, and that's the person you see, or a nurse practitioner, physician assistant, that's me, that's the person that you see. So we do a lot of health promotion and prevention in my clinic. We're the ones that talk about growth and development. We're the ones that try to keep you healthy, talking about vaccines, immunizations. But in my role specifically, we also see a lot of acute illnesses. So when you go to the doctor because you have a sore throat, or you fell, or you had a concussion, or you have a laceration, or you hurt your knee, or you have a rash, you have an ear infection, strep throat, mono, we see the whole gamut and realm of things in my clinic as well. So we're kind of we're primary care clinic to keep you healthy, but we also manage chronic diseases and treat a lot of acute things, kind of like the things that you would go to a walk-in for. We function very much with that as well. So that's where the minor acute and chronic disease management comes into play. I treat adults, children, I do women's health, geriatrics, so that's elderly people. In school, you also do clinical rotations. You got to get out there, you got to experience things, you got to learn as you go. And that really depends on the program and population focus that you're in. So again, the DNP program, that's the doctorate program with additional education. I believe most places it's a 2-year program beyond the master's, yeah. So lots of education if you want to be a DNP. Go ahead. Let's see, so some of the same, you must pass a national certifying board exam, both for your master's and to be able to prescribe medications. So when we look at certain medications, more so controlled substances, so people that take narcotics for pain, maybe after a surgery, people that maybe are on stimulants for management of ADD or ADHD, those sorts of medications are controlled medications, and you need to take a board certifying exam for that as well. So there's kind of different testing that you have to do. It varies state by state. So in the state of Wisconsin, we're very independent and we can act as independent providers. Some states don't allow certain prescriptive authority, meaning certain states don't allow nurse practitioners to prescribe some of those controlled substances. So it really depends on the state that you're in. Wisconsin is a great state to live in if you're a nurse practitioner. Go ahead. All right, so there's where we're at. Associate degrees such as maybe NTC, if somebody's just trying to get their feet wet, maybe they're needing to work while they're still going to school, that's a 2-year degree. Bachelor's is your 4-year degree. Then you have your master's, which I think you complete in a minimum of, I think, 2 or 3 years, but they give you a span of time to complete that. When I was in school, I had 2 really young kids and I was working and going to school at the same time, so it was a great program for myself. And then the end would be the DNP. Salary, everybody always wants to know how much money you're gonna make. So really kind of depends on the area that you're in. Are you working in a clinic? Are you working in a hospital? Are you doing travel nursing? Are you working in the OR? Are you working orthopedics? There's a huge realm of areas that you can be in for really all nursing degrees, not just a nurse practitioner. So it really depends on where you're at. You can see generally, looks like in 2020, average was 117,000 a year or whatever an hour. So primary factor in the dramatic increase in starting salaries is skyrocketing demand for NPs. Especially right now in the last 2 to 3 years in the COVID era, people are burned out. I have a lot of colleagues in this area, and people are really burned out, and some people are actually leaving the field, sadly. So it's not anything I want to deter anybody from, but it's a very challenging field right now. And recognizing NPs as the fifth most highly sought after advanced health professional in 2016. Let's see, when was the statistic? I don't know the date of that, but that may have changed. U.S. Bureau of Labor Statistics predicts the number of nurse practitioners will increase by 34% from 2012 to 2022, so we will see. Go ahead. All right, so since I'm the first person, do you guys have any PAs coming in? Physician assistants?
Do we?
Do you know?
I don't think we do.
So sometimes there's a great comparison. If you have a family member or you say, well, I don't see a nurse practitioner, but I see a physician assistant. So what's the difference? There are some significant differences. And you can see the comparisons here. A nurse practitioner has a bachelor's to a master's degree, and actually a physician assistant, when they first go to PA school, they can have a bachelor's degree in any area. So you could have a degree in business and say, you know what, this thing is just not for me, and I'm really thinking healthcare, and you go back as like a second career, and you can go and be a physician assistant. So nurse practitioners, especially in the state of Wisconsin, can work independently. Like I could just open up my own business, my own clinic if I wanted to. Physician assistants cannot in any state. They have to have physician oversight. We focus a lot on the nursing model, so we do a lot of patient education. When I first was kind of in you guys' shoes, deciding what I wanted to do when I grew up, I thought a lot about teaching, but I still like the medical field, and I think this is a great combination of both of those because we educate people about their disease process, about the medications they're taking, all of those sorts of things. PAs kind of focus on the medical model, not in a negative way, but they're there, they see you, and they're there to treat you, and they just don't do a lot of the touchy-feely sort of education stuff, sometimes that the nurses do. Very versatile as far as job availability, satisfaction is probably equal. Statistically higher salary for PAs, I do not know why. Both very vital members of the healthcare team. All right. So scope of practice, so my role may include, or does include, medical diagnosis and treatment, evaluation and management of acute and chronic diseases. So again, things that are acute, when you go to the doctor when you're not feeling good. Oh, go ahead. And chronic diseases, so high blood pressure, high cholesterol, diabetes, gout, ADD, ADHD, depression, anxiety, and the list goes on and on, heart disease, heart failure, all of those sorts of things. The interesting thing about primary care, when I see a patient, if I don't know what to do, I'm there in the moment, I have to stabilize that patient, figure things out, and then we can shoot them off to the specialist. So in my area of practice, I kind of think of it as knowing a little bit about all of the areas of the body, all of the body systems, versus maybe somebody that works in surgery or orthopedics or dermatology that deals with skin or pediatrics. Those people are very specialized. So those people still come in my door first, and it's important for me to figure those things out and then get them out to the specialist where they need to be. So obviously getting the patient history, conducting physical examinations, doing diagnostic imaging. I can order x-rays, CT scans, MRIs, ultrasounds. I'm not a radiologist, I don't interpret those, but the radiologist physician interprets those and those results come to me, and then I figure out what we're gonna do with those sorts of things. So, for example, if somebody comes in, they were at a football game, they hurt their knee, what is the process of figuring that out? There's usually a process. You have to start with an x-ray. At what point do you need to proceed with physical therapy? At what point do you need to proceed with an MRI? At what point do you need to proceed to get them to a specialist? So kind of using a stepwise approach with some of those acute conditions. Let's see, we do physical and occupational therapy referrals. We get people to rehab if they need to have physical rehab, if they need to have psychiatric rehab. We do those sorts of things. Again, prescribing medications for acute and chronic illnesses. So talking again about the prescriptive authority that varies state by state as far as those regulations.
Oh my gosh. And so, sorry,
You're fine.
unbelievable. All right, where were we? We were on a Google Doc, weren't we? There it
Yes,
is.
there you go. Prenatal care, I don't do prenatal care, so that's women that are pregnant. That's not within my scope. That would be a nurse midwife. As much as I love children and babies, that's not the area of specialty I went into. Family planning services, of course. Well child care, screening, immunizations, as we talked about. Pediatrics is my true love, so if I could see children all day, every day, I would. Let's see. I don't go to the hospital, so when we're looking at critical care settings, I don't work in the ER, I don't work in the hospital. I work in my clinic and my clinic only. So some of my colleagues, my physician colleagues, they do go to the hospital and see their patients in the hospital when their patients are ill. So when my patients, if they were hospitalized, they are taken care of by the physicians that just work in the hospital, and then all of the follow-up will be done with myself. Performing or assisting in minor surgeries and procedures. I wouldn't really call any of the things that I do in the office surgeries, but I definitely do procedures. Cyst removals, I do some forms of birth control placement, skin tags, warts, mole removal, all those sorts of things. So minor in-office procedures. And lots of counseling and education. All right. So again, here's a day in my work life, which is basically insane from the time I step foot in the door to the time I eventually leave. I don't do any hospital care. I see an average of 16 to 20 patients per day. And it gets to be a lot. It gets to be really overwhelming, especially in the era where everybody wants to get everything covered in one office visit. It gets to be a little bit of a challenge in trying to give the patients all the time that they need to have, but not getting behind in our day. And sometimes that means we have to have those people come back and go through some of their other questions or issues. I practice mainly pediatrics and women. That's just the people that tend to flock to me, I guess. Average age, maybe 18 to 65 is probably average, but I have had an influx of newborns recently. So as soon as those babies leave the hospital and are discharged, they can be in my care as a primary care provider. So again, no prenatal care, no obstetrical care for pregnant women, acute care visits, pre-op exams. I've had a ton of them. We've been a little bit delayed in surgeries as far as COVID, and so now I think we're playing a little catch up. All sorts of surgeries. People need their tonsils out. They have to have heart surgery. They have to have knee and hip replacements. They have fractures and breaks. So we need to make sure we're seeing those patients before they're put to sleep to make sure that all of their chronic medical conditions are optimized to lessen their risks for surgery. Just general physical exams, well child exam, medication checks. People that are on chronic medications, if you have high blood pressure, if you have diabetes, you should be coming to the doctor a minimum of twice a year. Make sure you're not having any side effects from medications. Make sure the medications are working for you, and just doing that constant reevaluation. Hospital discharge follow-up is very important. So again, when a patient is hospitalized, they are not under my care. They will come back to me after they are discharged. And there are certain guidelines, rules, and regulations about how can we keep those patients out of the hospital, and what can we do to provide services to them as an outpatient so that they're not readmitted to the hospital for the same problem. Again, some minor in-office procedures that you can see there. I work a lot with students. I've kind of taken a little hiatus from that in the last probably year and a half. It is very challenging to see 16 to 20 patients in a day, get all my work done in a day, all my extra paperwork, all my messages, and still help students and have them be successful and to teach them. So that is an important part of my job, but I've taken a little break from that recently. So, and again, educate all of our patients. The good, the bad, and the ugly comes with a lot. So pediatrics, again, I love to see children making a difference. So when you see somebody that comes in and really is feeling good, is feeling better about the ways that we have taught them to get healthy or be healthy. And I always think that's twofold. It's the things that we, doing the hard work for ourselves, the taking time for ourselves, the sleeping well, the eating well, the exercise, the time management, all of the things that we can try to control. And if we need medications as a tool to help people get better, we use that in addition. And then seeing those people back for follow-up and seeing them back and seeing them back. And that applies to really everything. I mean, whether people are feeling crummy because their blood pressure is out of control, whether they're really having issues, maybe they're depressed or have anxiety, and we've really worked with them to get them sleeping and to get them feeling better. When you see those people coming in and feeling better, we know that we've done our job. Patient and family satisfaction, same thing. I do have a lot of patients and families that I see. Babies, I've been doing this job for 10 years now, so I've seen some kids that are now 10, 11 years old that I've seen from newborn on, and then they have new siblings coming and new siblings, and I see the parents, so I really enjoy seeing the families and seeing them consistently over the years. The bad, discussing abnormal lab testing, results, imaging, hard thing to do. You know, when we get imaging tests, when we order imaging tests, when we order labs, we have to be accepting of what potentially might be coming of that result. So sometimes those things are bad results. There's cancer, there's heart failure, there's kidney failure, there's all of a sudden now people have diabetes. People get very upset, they get very worried, they get very concerned, they get very anxious. There is a new federal law that all lab results, all office visits, all patient notes are available to the patient immediately at the time of their discharge. So for example, we now have patients sitting in the ER and they might come in because their loved one fell and they're on a blood thinner. They want to make sure that grandpa, who's all confused and hit his head, doesn't have a bleed on his brain. So he goes to the CT scanner, CT scan is done, and all of a sudden before the patient's even in the room, the family member who's on the patient's medical account can see this result in their hand before the provider even comes in to talk about it. So that's created a lot of chaos in our world. So we have to be dealing with some of that. A lot of times, if the results are bad enough, we'll call the patient and we'll say, we need to discuss your results. I'd like to talk to you in person. Please bring a family member so that they have a support person there with them. And that has not occurred too often, for me anyways. Most frustrating thing, patients that come in, ask for help, and don't do what we want them to do. So feel very strongly about people having options and what are the risks and benefits of not doing something that I suggest. At the end of the day, I say it every single day, it's your body, your choice. I do believe in things like that, but my job is to identify problems, treat people, and prolong life. So when people get a little fired up or just don't show up, for follow-up, I've learned that I can't lose sleep over that. So lots of charting documentation. Everything you do has to be charted and documented on. So we are not given extra time in our day to write out our patient visits notes. So we are seeing 16 to 20 patients a day, give or take, doing notes, answering calls from patients, having physicians call us about questions. It's just kind of a never-ending thing. So, and death of patients. I haven't had that a whole lot, especially given my patient population. I have had some traumatic deaths of patients, and that's hard. It's something we signed up for, and we have to learn that we have to take care of ourselves too as providers and our own mental health when we're dealing with things like that. So, go ahead.
Before I go ahead, so why did they make that change that patients can have their
Yeah,
records?
so it was in a two-stage process. The initial stage was lab results, and so all diagnostic imaging, lab results, and provider office visit notes. The new one just came out at the end of August, where it's all nursing notes. So basically everything that is documented in the patient's chart. If you're on like a portal, like I can only speak to Aspirus, you have like a patient portal, you can log in, you're on the app, and they felt it's the patient's information, it's your record, it's your healthcare, and so that's where we're at. So.
It's just a lot of extra work, it seems.
Yes, so I have patients that are in the office in the morning and we run their EKG and I take a brief look at it and I say, it looks good, the cardiologist will confirm it. I'm comfortable with you going home. They get home, they're not even home, they're logged on, there's like, well, my EKG says this. Okay, so sometimes there's like subtle little variations of normal that are still normal, but it's very cumbersome. And you know, if you've got a lab result that's 0.2 above normal, it's okay. And as long as, you know, I've gotten to the point right now where I have to preface. Please give me time, I will get to your results. If there's anything urgent, I will be certain to let you know sooner than later. Otherwise, we'll wait for everything to come back, save our nurses time, and it's a lot of back and forth, so. All right, perks, versatility. You guys, if you want to work in nursing, you can work literally anywhere you want. So clinic, hospital, and the different specialties, OB, do you love elderly people and want to work in a nursing home? Do you love cardiology? Cardiac, heart stuff can be all over the board. Heart failure, high blood pressure, high cholesterol, heart rate, rhythm issues. Dermatology is skin. They do a lot of slicing and dicing stuff, figuring things out, moles, lesions. Orthopedics, a lot of people love orthopedics. So if you're kind of like, do I want to be a physical therapist? Do I want to be an orthopedic doctor? A lot of versatility there. Neurology, so looking at things like chronic migraines, head injuries, really in-depth neurological problems, multiple sclerosis, Parkinson's disease, those sorts of things. Urology, urinary issues, endocrinology is diabetes, hormonal sort of stuff, and surgery. You can do all sorts of stuff in surgery, especially just general surgery. So there's a lot to be said about if people want to travel. If you're young, fresh out of school, you're not tied down to anyone, anything, you go travel for a year or two, you'll make a lot of money, explore the world.
I had a friend who just came, he's been a nurse over in Green Bay, and had the opportunity to come back here, so he worked here for 8 weeks this summer, all right? Came back home. His paycheck was $70,000 for 8 weeks.
And he lived at home with his
And he lived at home with mom and dad.
Yep, making lots of money, short stints of time for a contract. If you want to chase the money, that's the way to chase the money. You probably work in that
Yes.
6 or 8 week amount of time.
Yeah.
You are working your butt off. I mean, you are working probably sun up to sundown. And you have to be really versatile if you're going to do that, because every location you go is going to be different. They're going to have a different routine, a different medical, electronic medical record. But usually young people learn really fast. So if you're kind of the person that is able to just go with the flow, that's a fantastic opportunity for people. Collegiality within the healthcare team. I actually started working as a CNA, you guys. Did CNA, and then I went and got my bachelor's, then I got my master's. So I've been through the realm. I've worked for Aspirus for 20 years. I know a lot of people in the community, and it has helped me tremendously in my career, and it's helped my patients tremendously when I'm able to just call somebody up and say, hey doc, I have this patient, can I run it by you, to work with those, and it's really benefited, me and my patients a lot. So preventative medicine, one of the best things, how can we keep people healthy? How can we keep you out of the hospital? I preach it all day long. And to advance the profession of nursing. So who knows what's going to happen in 5 or 10 years from now, and the baby boomers, and we're going to have a lot of physicians retire, and maybe we're going to have a lot of NPs and PAs and nurses that aren't going to want to go into their career. What are we going to do? I have absolutely no idea, but that's why it's important to get word out there and get people interested in the career. So. All right, these are real live pictures. This was some time ago. This little munchkin's like 3 or 4 years old now. So little newborn I saw, one of my good friends' little newborns, and another little patient of mine. All these photos are used with permission and in compliance with HIPAA privacy regulations. So, all right. There are a couple graphic photos, so I have a warning in there before I show graphic photos, okay? If anyone gets a little, we had this problem last time, did we not?
Did somebody,
With these x-rays flipped?
yes,
Yes.
Yeah, but I don't think they're all flipped, so my apologies.
let's see. I think that one's good.
No, they're not, some of them are flipped,
That
some of
one's
them
good.
not. Okay, I'll do my best. All right, so these are examples. Remember, I'm not an orthopedic surgeon, I'm not a dermatologist, I'm not an ER doctor. These are actually real life true scenarios of people that I've seen in my clinic. And so when they walk in the door, I can't see, well, I'm not an orthopedic doctor, I can't see. Like, I gotta figure it out, I gotta figure out where to get them. So this guy came in, 23-year-old guy, he had a prior ankle surgery with hardware placed for an ankle fracture, and he came in with just huge swelling of his ankle, and I was like, okay, dude, what's going on? You've got some hardware in your leg, let's figure out, is it malfunctioning? Sure enough, sorry, this is supposed to be like this way, but there's an arrow here, because the radiologists think us primary care people are pretty dumb, so they put an arrow there to show me that that screw in there is literally broke. So this guy had hardware put in his leg to fix his ankle fracture years ago, and he was having pain and swelling because the hardware was broke. I don't touch that with a 10-foot pole, back to orthopedics, so he's doing great now, so. Let's see, this is a 9-year-old girl. Some of these are super obvious, and I'll point them out to you. If radiology wasn't so kind to give us an arrow. This 9-year-old girl was just doing a cartwheel down the hill, and she hurt her arm, and she broke both her radius and her ulna. So when you're looking at x-rays, again, I'm not a radiologist, but you want to see nice, even movement throughout here, and clearly there is disruption in those bones on both sides. She went, and actually, you can see some soft tissue swelling up here too. Sorry, I can touch the board.
Yeah.
There's soft tissue swelling up there. That is a result of the injury. So she went to orthopedics, she had a surgery. She actually ended up with a lot of nerve issues after that and went in for some nerve revision surgery. So, but she's doing great now. She's like 14 now, so. This one is flipped also. This was one of my first probably bad results, the good, the bad, and the ugly. This x-ray is supposed to be this way. This is the patient's lungs. Here's her neck and trachea. Here's her heart. This lady had a huge mass in her lungs. She was having some shortness of breath. Did a chest x-ray. It's not super diagnostic for people for lung cancer, but if there's something there, we have to proceed and do further imaging. So this patient got sent for a CT scan, and she actually was diagnosed with stage 4 lung cancer. So she ultimately did pass after a short amount of time. She did not do well with treatment at all. This is one of my colleagues, her little guy. I did not see him in clinic. He actually had a scalding burn to his chest. You can see all that peeling skin there. For a little munchkin, he had it's probably a 2nd degree burn from boiling hot water. But that patient could have easily just showed up in my clinic. If I had an opening, or the mom could have just rushed him in because she's just freaking out. She's like, well, I know you're gonna walk in, but does anybody have any openings? And so I have to deal with that and say, okay, here's what happened. Does he need to see the wound clinic? Does he need to go to our burn specialist? Does he need to go to the ER? How can I manage this? How can I treat this? So. All right, this was not a patient I saw. This is actually my husband. Years ago, he had what did he do? Who knows? I think it was a football injury. Clearly, he displaced his finger. It's actually his ring finger, despite what you might think. And so this little bone chip right here, you can see there's a little shadow. That bone is supposed to be attached down here, and this whole joint is supposed to be moved over. So that fractured and pulled that and displaced that joint. So they were able to splint it and cast it enough to get it to stay. Otherwise, they thought they were going to have to pin it. There you go. Sorry, I'll try not to take it.
No, I don't think it.
Technology.
Technology, yep.
Give me the chalkboard.
That's back in my day.
I think the touchscreen part of it is off, so.
Okay.
So are we good or?
Yeah, you can go ahead. I haven't looked at some of these in a while. I'm kind of excited to always see what's next. This is a 44-year-old female who fell on her left arm. That's right. She was in the garage. She was like reaching out, putting away a bin of clothing on a shelf, and she kind of slipped and fell. What we worry sometimes, not so much with the forearm, but sometimes on the hand, is what we call a fall on an outstretched hand. So you can actually fracture a certain area of your hand, which can be a really bad fracture that can lead to like really bad issues in the hands. I'm glad it wasn't her hand, but it was her forearm. If you can see, they so kindly put another arrow there. This is a pretty bad fracture. It's called a comminuted fracture, and that's more of an orthopedic term, not something I generally would use, but it's nasty. It looks like a, just like a squiggly line sort of fracture. So she also got sent to orthopedics. This is just a different view, so it's interesting to see how different views, different positions, those are radiology technicians. I don't know if you guys have anybody coming in. So we have x-ray right there in our clinic, which is so wonderful. I don't know what we would do without them. They're trained to do different images, different positions of the x-rays that we order so that we can see all of those views of a potential injury. That's me, actually. That's something called the Raynaud's phenomenon. If anyone, I had been out running one day. It wasn't actually even that cold out, and it's just decreased sensation to like an extremity, like a toe, where it gets like a burning sensation. So this would be a scenario. Somebody could come in and say, "Oh my gosh, my fingers are white, my toes are white. They're numb and burning and tingly. What do I do about that?" And so then I have to talk to them. So it's not life-threatening. Oh, okay. So rapid photos, there's blood and tissue. If
We've
anyone
only had
doesn't do
like
that,
5 people pass out over the years. So
please turn around, put your head down, I'll tell you when you can look. So this is not a patient of mine, this is again my husband, but this has happened. People can just walk in randomly. We have, where we are in Cronenwater, we have Wasatayo down the way. I had a guy come in, he was at work and he shot a nail right through his finger. And I was like, well, good gravy, okay, so figure it out, call the orthopedic doc, take an x-ray, see if it went through the bone. Orthopedic doc pulled the x-ray up on his image, or gone at his clinic, he says, pull it out. And I'm like, are you sure? He's like, I reviewed the image, it's not through the bone quite yet, pull it out. I said, okay, and I couldn't pull the darn thing out, so I had to have one of my physician colleagues come in and help me pull it out. And then we got into orthopedics, we updated his tetanus vaccine, and off he went. So those sort of, scenarios come up all the time. So my husband actually got his hand caught between the tongue of a hay wagon and the ball of the truck where he was going to put the hay wagon on his trail hitch. And he wanted to, of course, protect his truck because the wagon was rolling, so he put his hand there, right? That's smart. So he had a huge, deep laceration, and this was like right when COVID started. We were in the ER waiting forever because this was a non-urgent. Seemed pretty urgent to me, but so all this white stuff you see, those are tendons. He actually did sever a tendon, so he's got a little bit of numb, tingly stuff in his hand once in a while. So they cleaned him up, stitched him up, and he's fine.
You gotta keep in mind, her husband graduated from Los Angeles.
Till the next injury. I think that's enough of the husband pull. Pretty sure. Okay, rapid photos are done. This is a little kiddo that I saw. He is quite old now. He's like 4. This little munchkin came in for his 1-year visit, and his mom says, well, something seems weird in his collarbone, and he seems kind of in pain when he moved his arm around. He actually did have a broken or fractured collarbone at birth. So when that baby's coming through that birth canal, if there's not a lot of room, but that baby's still coming out, the first thing that's gonna go is the clavicle or the collarbone. So he snapped it in half, which I actually have a newborn right now that has a broken collarbone. And this big white, so it's literally like broken, if you can see that. This big white is a callus, so that's healing because this was missed at birth. So